Good afternoon. Look who I have. Say hello to everybody, darling. Say hello to everybody. Oh, are you shy? Are you being shy? We wanted to show you our outfit of the day. We're wearing a little tie-dye that has ice cream cones on it, and it buttons on the side, and it comes with little tie-dye pants and a little tie-dye cap. Yes, it does, darling. Yes, it is. I'm going to tell you, this little baby is bringing me a lot of joy. Today's kind of a day that Mommy's not feeling all that well. So she gets a lot of joy from holding her little Bella. Yes, her name is Bella. And today's kind of a loopy day because Mama's having a little lupus flare. And that's when she needs Bella to make her feel better. Yes. You know, these reborns bring us so much joy and happiness. And this little girl is so cuddly. And she's my sweetie pie. Yes, she's my sweet girl. She loves kisses from Mommy. Yes, she does. Yeah, you're a good little kisser. You're Mommy's sweetie pie. Oh, she's so precious. I haven't thought of a middle name, but her first name is Bella. Yes, it is. And she's got the prettiest little eyes. And she's really looking. Can you look right here at the camera, Bella? Can you look at the camera? Yeah? Do you see yourself? You see yourself, baby? How you see yourself? She's been a lot of comfort to me. Yes, she has. And I don't know about y'all, but when I'm feeling bad or having a day where I just don't feel quite myself, if I hold a reborn, it brings so much comfort to me. It just makes you relax and feel so good. And especially when she's a real pretty girl. Yes. Oh, I just think she looks so cute in this little outfit. I bought this for her coming home outfit, and it's real sweet and soft, and look at those eyes. Oh, y'all excuse my appearance, but I could not get on here and make it a little video about my sweet girl. Yeah, we need to do a changing video maybe tomorrow. It's funny how stress affects you, and boy, this thing with my mother has really turned into quite the experience. Yes, it has. We're not having the best care in the world at the nursing home, are we, darling? They didn't even put Mother on the bath schedule. She's been there a week, so she had to be bathed by someone that was in the family. And then we asked them to put her on the bath schedule. It's just so many neglectful things that are happening that, oh, if I didn't have lupus, I could do it all. I could go up there and bathe her and make sure she was fed, make sure she had her therapy. But I went and sat yesterday after Bella came to live with us, and I sat there and helped for about 4 hours, and now I'm like a zombie today, and I can't hardly walk. I'm so stove up and sore, and just in a flare from the stress of not knowing what's going to happen with Mom. Even though we're trusting in the Lord, we know things will be okay, but old human nature takes over and tries to pull a trick on us, doesn't it? Yes, it does, darling. And that's when Mama says, Bella, will you come hold me? And she does. She holds Mama. Yeah. Bella holds Mama. Yeah. Oh, you being shy, baby girl. Are you being shy? Look at that face. Just look at that darling face. She's a little bit of a shy girl sometimes. Yeah, she's getting about ready to take a nap with Mommy. We might take a nap together. Oh, I tell you, the cycle of life, whew, gets to be really something, doesn't it? Now, my sister's coming tomorrow. She takes Daddy to chemo every Wednesday. Yes, she does. So we may have to go sit with Nana. Yeah. So someone was coming today to check with Mother about going to another assisted living facility because the nurse was rather rude to my mom yesterday, and Mom asked for something for anxiety because she couldn't breathe well. They had not resumed her Lasix. She has congestive heart failure, and she was retaining so much fluid. She just blown up like a bullfrog, and so due to that, she asked for something for anxiety, and they brought her in a pain pill, and she told them that she didn't need the pain pill, and the nurse took her hand like this and shoved it and told her to take it. And needless to say, I called and talked to the nurse and told her that she was not to go in my mom's room again because Mom was frightened of her. You have to think, if you're flat on your back, you can't get up, you can't move your leg, you can't sit up straight, and someone comes in and does something like that to you, it's frightening, especially when you're elderly and ill. So I did not want her going in and frightening Mama. So we went up there and sat with her, but it makes it hard because we don't know if she's going to be there or where. Someone's supposed to come talk to her today about another facility in Lubbock, which is 20 minutes away. It's very convenient over here, but there are a lot of problems, though. A lot of problems. Yes, there are. The first room Mother was in, the first night she was there, her phone got stolen. And hers wasn't the only one that night. There were 2 phones stolen that night. And then I spent the whole night with her, and the air conditioner was not working, and it was one of those really hot days. So she was so beet red, her little face, and I kept trying to bathe her face with cool rag, and I had a fan on her and giving her ice water, but finally I got the window to open and it wouldn't stay open. I propped it open and we got some relief. And there was not a bathroom in there. Not that Mother can use it because she can't get out of bed, but Dad stays all day and he needed a bathroom, so absolutely they were, they're paying for air conditioning and a bathroom, and I asked the nurse to please move us to a room that had air conditioning and a bathroom, and I told her about how hot my mom was, and the girls that had come in to talk to Mom and take care of her told her that this room was always really, really hot. That last summer it was almost unbearable. So they moved us. That was an ordeal in itself. And things were going a little bit better, but she was never put on the bath schedule, and they have a ruling now in the hospitals that are in the nursing homes, you can't have side rails. It's against the state law, can you believe? And Mom has a tendency to get over on that right side. Oh my goodness, I'm afraid she's going to fall out, but they cannot have bed rails, and they can't put Foley catheters in. Things are changing under the Obamacare ruling. Yes, they are. Lots of things are changing. So I pray that Mama doesn't fall out of that bed. I told the nurse yesterday I was very concerned, and that we had some side rails at home that can slip under the mattress. Could we bring them? And they said, no, no, no. It's against the state law. Can you believe that? Then she has, one of her arms is swelled up because she laid on it. They had, during surgery, they didn't realize it. She was laying on her arm, and it has swollen up, and I've just been waiting. I've been addressing it every day to the nursing staff it's hot and it looks like she's developing cellulitis, but not until yesterday I finally got someone to listen to me. And can you believe, this is something else. Since she's been there, she has not seen a doctor, physician's assistant, nurse practitioner, not even for the first time. I mean, not even for her admission. And I asked yesterday when a nurse would come in, or a doctor, and they said, oh, they don't unless we call them. I said, not even for admission? They don't even want to see their patient? And they called her and told her that I would like for her to look at my mom's arm today. So the nurse practitioner is coming today to check Mama's arm. And if it is cellulitis, she'll need to be on antibiotics. And Mom was having some pain behind her affected knee, which Mom has had 2 blood clots that went to her lungs in the past, pulmonary embolism, and it's a very dangerous situation. And she told the nurse about that, so maybe they'll check that out. So we're hoping that everybody will check Nana out, aren't we, darling? Yeah, Nana needs to be checked out really good because we love Nana and we want her to have the best care ever. Yes, we do. You know, guys, I think the saddest thing is I want to be able to take care of my mom myself, but there's no way. Even if I was healthy, I couldn't because I can't lift her. But I feel, and I know all of you probably that have been through this feel this way too, I feel so guilty for her being in there. And I guess because of that, I'm extra cautious, and I want her to have the very best care. And I don't think that asking for a bath, she's been in there a week and they haven't even mentioned a bath, I don't think that's asking too much. And I don't think asking for air conditioning is asking too much, you know? But it's just that, I don't know, so many people now that work in places like that, they're just doing it for the money and they don't have the compassion. And Lord knows it's a hard job. My goodness, they are running day in and day out, and there's so many difficult patients, and I really do feel sorry for them. And I know how that is. I've been a nurse working like that, and I know how it is to work with difficult patients, but you have to keep your cool. You can't push them or be mean to them. Nobody wants to be mean to people, do they, darling? They're just like Bella. The little old people are like Bella. They have to have love and affection and be taken care of because they're helpless. Yes, they are. They've become like Bella, little helpless. Yeah. And all they need is love. So I'd appreciate you continuing your prayers as our saga continues. The physical therapist is working with Mom. Of course, all they can do is the unaffected leg and her arms. But he seems wonderful, and the occupational therapist is so good. So there are some good points, yes, there are, to that place. So we just wanted to come in and give you a little update on Nana and ask you to pray for everybody. And stress causes lupus causes a flare, and I have not been in a flare in a long time. But I am a major flare now, and that's why I'm so happy to have Bella. Bella, can you say, hello, YouTube? Hi. I like my new mommy. And hello to my other mommy. I'm okay. I like Texas. Mommy's being nice to me. Oh, she smells divine. She's so sweet. Excuse my appearance. All I can do is lay here right now and try to stay calm and wait for this to pass. But we can do that. Yes, we can. With the grace of God, we can do that. Never give up, guys.